wonderful to see you all here this morning. I'm Joanne Bundy, and my job is to remind you to silence your cell phones, Jack, and also to turn on your tea coil if you use that. This is the third class of our four-class course on grief and loss, taught by J.R. Paulson, who is the primary care physician at Grinnell Family Care. I'm going to turn it right over to him this morning because I know he has a lot to cover. So please welcome again, Dr. J.R. Paulson.
Sound test, can you hear me in the back? You guys? Good. Okay, well, let's get started. Class 3 in good grief. Why is that girl so sad? I would say she's grieving, wouldn't you? Body language? Why are these kids so sad? And what are those things on their heads? Why is this player grieving? What did this guy lose? And I'm sure he's really grieving these days. Mr. Bostic, because he lost the ball. And a lot of... So, did any of you Packer fans experience a loss? Raise your hand. Yeah, okay, good. Any stages of grief? Any denial? Any anger? Any bargaining? Any depression? What ifs? Did you intellectually analyze the game? Was it too conservative and going for 3 points instead of, remember, retrospective what ifs? But what did you feel? Did you feel emotions? If you're a real Packer fan, you did. You still are. How long will you mourn? Next week? Next season? Just an example of loss. So I'm trying to frame this whole talk about death and dying, grief and loss. Losses are the same. And the mechanisms we use to deal with them are, I posit, are going to be pretty much the same. So, no, mind her. I brought along my grief counselor just in case. So.
At the beginning, it seemed to me you equated sadness and grief as the same thing in some of those pictures.
Oh,
Is that...
no. Okay, the question is do I equate sadness and grief? Grief is the feelings we have for a loss. And those feelings can incorporate sadness, hopelessness, anger, depression, 8 zillion feelings.
All right.
Does that make sense?
Yeah.
So those of you, next time, take your grief counselor, take me along, and I'll help you deal with the loss if you don't do too well in it. Okay? So, part 3, framing grief and loss. Or, fortune cookie wisdom and tennis and football. So how am I going to incorporate all of those into this? So what do I mean by framing grief and loss? Or, how to be happy when it seems like everything is going to hell in a handbasket. Some of you have talked to me about some of your health issues. You feel like you're going the wrong way. How are you going to be happy about that? Well, yeah. Themes for remaining classes. The crucial role our belief system plays in how we see and deal with loss. Many of you probably haven't thought about this, but I'm going to challenge you to do that. How losses can be seen as opportunities for growth. And that sounds like something you get on a Hallmark card. Oh, opportunity for growth. Yeah, right. Well, we'll see if that isn't in fact true. The relationship between our emotional well-being and our physical well-being. Remember from the well-being class, we had the long continuum of physical health, and you had the one of emotional health. And where are you on the physical? Where are you on the emotional? You go up on one, you go up on the other, you go down on one, you go down on the other. We saw a pretty good correlation in some of that, correct? Well, let's look at that relationship a little closer. Specific suggestions on how to deal with loss and grief, and that's going to be mainly next week. I'm going to come out and say this is how a model suggestions of how I think people can deal with grief and loss, and pretty nitty gritty for yourself and for other people, and ultimately how to help others with their losses. We may be doing okay, but how about a friend or a relative? Review the Covey's circle of control and influence to see how it affects loss and grieving. Get that for next week. And perhaps make the world a better, happier place in the process. So that would be a pretty good side thing to do. Talk about your second part of your homework assignment after break, but any of you get a chance to ever read this article or take a look at it?
Yeah.
It's still out there. So, ensure my position. Doubtless, death is a loss. It deprives us of experiences, of milestones, of time spent with our spouse and children. Short, it deprives us of all the things we value. Loss, right? Death is a loss. But, he says, this hypothesis, living too long is also a loss. It renders many of us, if not disabled, then faltering and declining. A state that may not be worse than death, but is nonetheless deprived. Robs us of our creativity and our ability to contribute to work, society, and the world. Transforms how people experience us, relate to us, and most important, remember us. We're no longer remembered as vibrant and engaging, but as feeble, ineffective, even pathetic. This was confirmed by a recent worldwide assessment of healthy life expectancy done by Harvard. The researchers included not just physical but also mental disabilities such as depression and dementia. They found not a compression of morbidity, but in fact an expansion, an increase in the absolute number of years lost to disability as life expectancy rises. That doesn't sound very good. I reject this aspiration. I think this manic desperation to endlessly extend life is misguided and potentially destructive. For many reasons, 75 is a pretty good age to aim to stop. Any over 75? Well, I'm going to try to refute this hypothesis in the latter part of the class, and see if I can win the argument on that. Any of you see this movie, Unbroken, or read the book?
Oh, yes.
Great, well, see the movie and or read the book, but better yet, read the book. Because we're going to talk about that. The movie was released at Christmas. I liked the movie, but I was profoundly disappointed. Because it stopped when I would have started the main part of the movie and what I think is the most important part. So I'm going to come back and say why Angelina Jolie and the part she wrote just reflects our society rather than what the goals we're going to have for this class. So we're going to reinterpret some of that and get back to that. And the book is just, it's just excellent and true. Fortune cookie wisdom. Lynn and I ate at a Chinese restaurant last week, and this was in my fortune cookie. Pleasant experiences make life delightful. Painful experiences lead to growth. I went, boy, that's pretty good for my class. That's why there's a star over there. Remember, if it's a star, that means it's key point. That is good fortune cookie wisdom. But I have to explain to that. Or to quote Nietzsche, what does not destroy me makes me stronger. Read that quote? I like Nietzsche. What do we mean by frame? All of our perceptions and most of our feelings are seen or filtered through the lens of our beliefs. Remember in the first class on truth, I told you how what we think is truth is filtered by these glasses we wear, the system we have that think it's objective reality, when in fact, all these other factors are going into the truth. Well, same In this case, it's our beliefs. This is based not on rational thought or analysis of what's right or true, but framed within the superstructure of our social, culture, and religious or spiritual values and beliefs. Think about that. How we manifest grief, that is mourn, is determined mainly by where and when we lived, or more specifically, where and when we were raised. How we grieve determines where we are on the emotional continuum. Those tied into the last class. Where you are on that line right now, today, last week, where you're going to be, I posit, has to do with how you deal with grief and loss. Recall in that lecture how depression or sadness can be endogenous or exogenous. That means, does it come from outside, something that happens in the world, or does it come from inside? They're very different. In my experience, it's usually exogenous, or due to something or some event that has happened to the person. But most people that have depression, it's a reaction to something that's happened or gone out there. Sometimes it just comes from no reason. And in most cases, it's due to some sort of loss, either single, compound, or cumulative. My hypothesis for depression is that it's multifactorial. It's that biologic, psychological, social, and spiritual. I asserted that the major determinants for happiness are how we view ourselves, how we view the world, and that most, but not all, neurochemical changes occur in response to number 1 and 2. Maybe you recall that. That stress, acute or chronic, can lead to depression through a variety of mechanisms, which we're understanding more and more. And 5, much of the stress is due to loss or losses mostly unresolved. So these are my hypotheses that I want to expand on today. And a little star to remind you, I think, this important point. Society tells us how to dress, tells us how to act, tells us how to feel, and what not to feel, whether we're aware of it or not. Tells us how to grieve, men versus women. This is a picture of a well-dressed man in 1900. Notice the hats, the similarity in dress. It's the women of the time in their fashionable garb at that time. So I Googled women's fashion 2015 and got this. A little different. Pretty colorful, pretty dramatic, pretty variety. Quite a bit of variety. Or this. Society says, oh, these things are fine. The color did not come out in this, but they're supposed to all be pink. Why did I pick pink? Because pink is a no-no color for males, or has been in the past. And these fire guys are all macho, but they're all wearing pink. Well, I don't know about you guys, but when I was back in the high school, you wore pink.
Oh, boy.
What were you considered? You were probably gay. Did you get teased if you wore pink? Yeah. More than that? Yeah. Bullied? Yeah. You wouldn't make it off the playground. Just by wearing a color, filter down to the kids. Anyone know what this symbol is? It's supposed to be pink, not lavender. It's what the Nazis had the gay men wear in the concentration camps. So the Jews had that, but if you were gay, you wore a pink, downward pointing arrow. Now, with the breast cancer, real men wear pink. It's a campaign, you see football players, you see pink stuff. All of a sudden it changed. Wait a minute, what happened to color now? Real men can wear pink. See the change? I was sad to see this picture of the G8 because look what all the men are wearing. Ridiculously homogeneous. Where's all the variety like women had in their dress? Where's the color? Where's the different costumes from their countries? All westernized, with the ties the same color, and their shoes are probably all the same. I find this very disappointing. Men and women grieve differently. Men, this is a generalization, want to fix it. Less verbal. Date and remarry sooner after a loss. Like to assist. We like to be helpful. May express anger over the situation. Do better with an activity or task. Keep us busy. We like to stand shoulder to shoulder with other men. Women, on the other hand, more verbal. They seem to get a sense of failure more often, a sense of guilt, need to grieve openly, thoughts and feelings about the loss, limit physical contact, isolation. They tend to try to communicate face to face. I think this is kind of a generalization. We saw how men and women are treated out of the womb, right? Well, is there any reason this is how? But is this really natural? This is the way it's supposed to be? No, I'm saying this is what society has taught us. But 25% of men grieve like women. And about 20% of women react like men. Therefore, society's imprinting is not quite perfect. We don't all act like we are supposed to. But how are these outliers treated? Religious beliefs are intertwined with social conditioning to reinforce these norms. So it's the social conditioning, and in most cultures, there's religious conditioning that goes on. Some of these have changed to become more tolerant and inclusive. Just think of the evolution in dress for many nuns, what they used to wear, what they can wear now. Witness the acknowledgement and increasing acceptance of the LGBTQ community. That didn't happen when I was a kid in high school. Nevertheless, there is and will always be conflict between different religions, subsects, and the community at large. Not as large, at large. Xenophobia will always be with us, unfortunately. They're all evolving, but at different paces, and in different cultures, in different generations, and in different countries. Grief, as we mentioned before, can be defined as an emotional, psychological, and spiritual journey to healing. It isn't just about emotions. If that's the case, then analyzing and challenging our belief system is part of the process. I don't find people talking about this or looking at this much. What are some of our modern Western society's beliefs? In general, our society places enormous pressure on us to get over a loss and to get through the grief, right? In modern Western society, death is optional and to be avoided as long as possible. It's seen as a defeat by modern medicine. We don't talk about death. So-and-so passed, they're with God. We don't say they're dead. We don't even like to use the word death. We don't plan for it. I find this really cuts to the quick. If you have a birthday, somebody's birthday coming up next week, and you're going to plan a party for it, you do some planning, right? Get presents, get food, you buy guests, you plan for it. If some of you are going on a vacation this summer, 2 weeks, 3 weeks, you do a lot of planning. Where are you going to go? You get the books out. You're going to go to Europe. You're going to go here. You get this. You get your shots. You get your medicine. You get packed. You do all this stuff to plan, right? Way ahead of time. What's the biggest journey of your life? Seriously. What is it? Your death. The biggest journey you're ever going to go on. You know it's coming. It's not optional. How are you preparing for that? How do we in Western society? Most of us don't. So I just find like, wait a minute, this is the biggest thing. So that's why in hospice and living wills, let's get in there. Let's talk about that. How do I want my death to be like? This is the biggest trip you're ever going to be on, folks. So let's start thinking about it. But we're a death-denying society. That ain't going to happen to us. Difference in time period. Then, we died at home. Family prepared the body. They washed it. They cleaned it. It was viewed in the house, in the parlor. Buried by the family, maybe on the farm, in the backyard. Children were included. Relatives were close. Community knew the person. They lived in a small town. Family and social structure facilitated the grieving. They gave time to grieve. There's no medical decisions. You didn't have to decide anything. The doctor came in and you couldn't do much. You just supported the person or gave him a little laudanum or opium, and that was it. Cost issues usually weren't a concern. If Grandma died at home, there's not some big bill she's going to get later from the hospital. Now, we die in the hospital, often in the ICU. The funeral homes prepare the body. We don't have to get in contact with the body anymore. It's viewed at the funeral home. Nice sterile environment. Burial set up by the funeral home. Children are often excluded. Kids can't visit in the ICU. Oh, maybe you shouldn't take the kid to the funeral. Family is scattered. They're not all here. Some of them are all over. Some can't come. The email. Often die among strangers in the hospital, or before you died with your family members around. Current structures don't often facilitate grieving. We got to get out of this bed, get out of there, get moving. We got more patients that are going to be coming in. Get on with it mentality. Medical decisions to be made. Do we want a feeding tube? Had 2 patients in the last week with major strokes. Issue, feeding tube, not feeding tube. How much should we keep their IVs going? What do we do? All these medical decisions. We didn't have those back then. We got them now. Cost is a concern. You're going to go through some chemotherapy, you're going to do all this stuff. You better think about what the consequences, the finances are going to be. So, very different scenario. On an important related theme, what does our culture and society seem to value? I would suggest,
Yes.
am I right or off base? I look around, that's what I see. What are the people in our society most admired today? What heroes do youth have to role model the values on today? Ooh, Leonardo DiCaprio made about $77 million last year. Angelina, who also directed Unbroken, a pretty good movie actress on her own. Some of you girls like Tom. Or Johnny Depp. Or baseball, Barry Bonds. Heroes. But, how do you get a body like this? Yeah, I never took drugs. I never had sex with that woman. Well, what does this do if you're a kid? You know, you've got this baseball hero in baseball, and now you're finding, yeah, he's hit all these home runs, but, I mean, it just kind of, and why does he do it? To get more home runs, to get more money. To get more home runs, get more money, get more, right, fine. So, pushing for more have. Remember in our society, it's a have, so. Another example of needing to win at all costs. You've got to have that win. So our societies win at all costs. I have to dope or gene dope, that's fine. Tiger Woods. I'm a great golfer, but don't talk about my marriage or my life off the course. And we know what Tiger's extracurricular activities were. These are our heroes, folks. They were my heroes at one time. I thought, wow, oh, Tiger Woods. And then, what values do they have? What do they teach me? Michael Jackson, probably the greatest entertainer ever. That's how Michael Jackson ended up, as all of you know. One of my other favorite all-time actors. He's great. Actor Philip Seymour Hoffman, found in a New York apartment. Needle in his arm, died of accidental overdose of drugs. The cause of death was acute drug intoxication, including heroin, cocaine, benzodiazepines, and amphetamines, according to the medical examiner. So fame, money doesn't seem to do it in our culture, even though that's what we're asked to believe. I think I go on and on. I think you'll agree with me that our present society, not so subtle messages, to have more means to be happy. The corollary is to lose more, or to lose is to be unhappy. Loss, get it? Exclamation. So when people lose stuff, we're conditioned, oh, that's bad. To have more stuff is good. Happiness that way, sadness, losing, going that way. What do other cultures do? How do they deal specifically with death and loss? Grief is an instinct. So you can look at grief as a natural biologic process. At the biologic level, it might seem that grief is universal. In every culture, people cry or seem to want to cry after the death of it that's significant to them. Grief then could be conceived as an instinctual response shaped by evolutionary development. Perhaps animals grieve. No, that's wrong. They do grieve. We know that, beyond a doubt. Grief is finding meaning. I think this is very important. Beyond instinctual responses lies the realm of thought or meaning, which has been excluded from many definitions of both grieving and mourning. When a significant person dies, the issue of meaning is central for the survivors. What does this death mean? What does this life mean? What did this person mean to me and to this community? Western, not Eastern, Western individuals who successfully come to terms with a traumatic death may change how they think about themselves, how they relate to others, and how they view life in general. This is why focusing on the stages of grief misses a very important component of healing, I think. Continuing bonds with the dead. It's another mechanism of grief that I think is important to look at. In other words, people's important to us become part of our inner conversation and remain there after they die. If someone says, I wouldn't do that because my mother would be disappointed. The mother is still part of that person's inner conversation, even though the mother is not present and we never find out if the person did it or not. People are important to us, may continue to play important roles in our lives and the life of the community for many years after they're dead. Right? So this is the fact of loss and grief that I think we need to emphasize. What's that? Mexico. What do they celebrate every year? Day of the Dead. That's Katrina. And they make a big deal. This is a holiday. Anyone recognize what this is from my Song Dynasty lecture? I don't expect you to. How many of you eat at the Chung Garden? Well, that's the Rainbow Bridge. It's on the mural on the wall. I told you that was in the Song Dynasty, long mural, and that is the Festival of the Dead along the river. And everybody is out, and they're eating, they're celebrating death and relatives, and it's a big deal. So other cultures do celebrate death in a remembrance way. The grief police. Yeah, this is really important. When an individual and family grieve within the larger social narratives, larger political dynamics are in play. Society polices grief. It controls and instructs the bereaved about how to think, feel, and behave. All societies have rules about how the emotions of grief are to be displayed and handled. Some cultures, for example, those who grieve should talk to the dead. In other cultures, the name of the dead should never be spoken. Such coercion is, of course, a top-down matter. Those who don't conform to the social expectations are labeled aberrant. In contemporary psychotherapeutic culture, aberrant grief is deemed pathological. In other cultures, the labels would be different. Counter-revolutionary in communist cultures, sinful or idolatrous in monotheistic religions, such as Muslim. One cultural project seems to compare the rules about emotional expression of grief. Anthropologists, example, compared the rules in Egypt and Bali, both Islamic cultures. So here's Islamic cultures, two different places. She found that in Bali, women were strongly discouraged from crying. Women, you just keep it all together and keep it in. While in Egypt, women were considered abnormal if they did not incapacitate themselves in demonstrative weeping. So here's your religion, Islam, but you're in this one culture, it says women don't cry openly, and the other, wail and flail yourself on the thing. Where did this come from? Social. So what is natural grief? If you cut out all this, what should grieving really be like? And that's what we're going to try to find out. Another Nietzsche. The individual has always had to struggle to keep from being overwhelmed by the tribe. I love that quote. And if you try it, you'll be lonely often, sometimes frightened. But no price is too high to pay for the privilege of owning yourself. Japanese funeral. Different than ours. This is a Japanese man on his cell phone a number of years ago. NPR. Grief-stricken Japanese reluctant to open up. With the earthquake, this is tsunami and the nuclear crisis in Japan, much has been made of Japanese resilience in the facing of adversity. But some are saying there's too much resilience. In fact, in times of unbelievable trauma like this, the Japanese people need to let go of their emotions a little bit more. So they interviewed this government worker in this office, thanking for his help in this. But during the interview, he retreats in embarrassment, understandably overwhelmed by his personal, communal, and national grief, or perhaps all three. They're trying to interview him and he's trying to break down, but that's in their society, you don't want to show that. An American might well do the same in similar circumstances, but it's not unusual in Japan for people to feel ashamed at showing their emotions in public. Says Suzuki, the director of a grief counseling center in Tokyo. Japan has a shame culture. We are very much ashamed to behave in an irresponsible way in a public place. That is demonstrated in some ways we express our grief. I use the term grief, but some 15 years ago, I don't even know that kind of term. He doesn't even have a word for grief in the language. 15 years. Why are you going to express it if you don't even have a word for it? I don't even know this term. And if I say grief to quite well-educated people, they say, what are you talking about? What is this? Is this woman feeling grief? She's doing what society, now she doesn't know if she's being photographed, or she may try to hold some of that in. Yoko, 59, sits on the floor with her daughter. There's no other way we can survive than we say to each other like a prayer. Gambari, I don't know how you pronounce this correctly. Gambari, go for it, be positive, be positive. She says through an interpreter. That's why we say that a lot. I actually saw my house washed away and everything is lost. And I try not to think, big picture. And I just keep this word, gambari. That's all I can do. So the grief counselor says, yeah, that's fine, it's important, but the inner strength are admirable, but he says, wherever culture you're coming from, keeping all bottled up doesn't help. It's not denying the spirit, but we need at the same time, if you're a very strong personality, can't deny that trauma affects people. Whether you like it or not, whether you admit it or not, your brain has been affected and we need some help. So that's just a little snippet of Chinese group mourning in a hospital or death. Again, you see the cultural thing. In this country, a little girl with a picture of her dad who was killed in the Civil War and wearing black. 1861, death of Queen Victoria's husband, Albert. See what the girls are doing? What they're wearing? Little baby, can't afford anything, but has on his wrist a little grieving black So we've had some things over the time. However, it is religious belief that shapes and defines grief and mourning more than anything else. These can vary as much as the vast number of beliefs in sex. A few examples. So let's take a little break, and then I want to briefly go through a few religious cultures and the way that they look at death and dying and grief, and then continue from there. So enjoy your break.
Thank you for taking your chairs and even being quiet before I got up here. Now, if any of you have had a problem with making plans for your death, I think maybe I can help you out a little bit. When I worked at the college, I was the director of planned giving, and that involved helping college alumni make plans to leave gifts to the college, and it included wills and trusts and that sort of thing. Well, we had a gentleman alumnus who was in his late 70s, and he felt that if he made out a will, it was a death sentence, that he would die for sure. So his health wasn't all that good, and he made it known to me that he wanted to leave his entire estate to the college. Now, he was a bachelor, so he never married, didn't have any children. He just had this wonderful estate that he wanted to leave. So I encouraged him to make it legal, you know, to have a will, put it as a will what he wanted to do with his estate. But we couldn't get him to do it. And I worked with his attorney, and even though this gentleman went to the hospital seriously ill a couple of times, he still didn't make out a will because he thought that was his death sentence. So finally, one day, his attorney called me, and he said, so-and-so has made out a will. And I said, how did you ever manage it? And he said, well, I explained to him what the government was going to take if he didn't have it made out. So whatever works. So now back to JR.
Can't top that story. Great. Lord G. King asked Confucius, who among his disciples loved learning? Confucius replied, there was Yan Hui, I'm not sure the pronunciation again, who loved learning. This was his favorite disciple. Alas, his life was short. He is dead, and now there's no one. Yan died. The master said, alas, heaven is destroying me. Heaven is destroying me. Yan died. The master wailed wildly. His followers said, Master, such grief is not proper. The master said, in mourning such a man, what sort of grief would be proper? A lot of ancestor worship. They continually have altars in their homes to be reminded of the deceased and departed, often going back many generations. Now, I'm not going to spend more than about 10 minutes, but I want to give you a little outside our culture, what some other beliefs look at death and dying like. So Hinduism, a lot of sects, but they typically believe in eternal life through reincarnation. Now, we're going to find out more in the next class that what you think happens to you after you die is kind of important on how you're going to take this event. Or if your loved ones go, how you're going to deal with that. And this is what religion has done ever since caveman and people first started having any kind of religion, answering these questions. What happens after people die? Do they live on? What goes on? So the Hindus believe, of course, in the type of reincarnation. And that their fate in the next life depends on their virtue in this life. Cremation takes place on the day of death. The family washes the body in a special ritual. Priest officiates it. White is traditionally worn, not black. So don't go to a Hindi funeral wearing black. Grieving period. 13 days of official mourning, which friends and family offer support and condolences. We're going to find out that every religion has its own prescription for mourning and bereavement, which is very helpful. It gives direction to people. So the body is carried around so everyone can see. Faces uncovered in the crowd. in cremation. For you women, the practice of sati, or widow burning. How many of you are familiar with that? So the widow is so much grief that she comes on the funeral pyre of her husband. Hindu wives still burn themselves alive when their husbands die. This was an article in 2006. Widows in some states of India immolate themselves on a funeral pyre in accordance with sati, an ancient Indian practice. Authorities are aware of at least 2 cases just in this last month. This 35-year-old widow in a village in the northern state, the woman is survived by 3 children. So you lose your father, and then your mother commits suicide. The relatives of the deceased husbands persuaded the woman that her life would have been unbearably disgraceful, and that she'd be better off dead by fire, at least spokesman said. Power of community, power of belief. Jewish. I would like to spend a lot of time with Jewish because in my experience, what I've learned is they have the most comprehensive grief plan program specific. But it's really kind of cool. And I'd like to, you can spend a lot of time with this. And I just want to hit a couple, highlights. Usually take place within a day or 2 of the death, the funerals. Cremation is not practiced. So all of a sudden we got a totally different view than we have with Hindi. At least among the conservative or Orthodox Jews. Rabbi Cantor, 7-day period, the first morning is called sitting Shiva, practice which prayers are offered, the family talks about the deceased. Friends and family bring meals. Does teach the existence, the faith of an afterlife, but it's not the focus of mourning rituals. Afterlife, but it's not the, they're having, they're doing this, and all these things are happening. Forgiveness is an important part of the grieving process. Care for the dead. Very, very specific. The body is never left alone until burial. You have people that can come and help sit with you. Professional mourners, people that will come and help. Let's see what else I have here. They dress the body. And if they have a coffin, it should be simple. So that a poor person would not receive, say, less honor than a rich person. What do we do? Who's got the bigger stone in the cemetery? Who's got the big mausoleum? Who's got the bigger memorial? A little different tradition, isn't it? Body must not be cremated. It must be buried in the earth. Coffins are not required, but if they're used, they must have holes drilled in them so the body comes in contact with the earth. And we have all our stainless steel triple-lined coffins so the worms won't get us, or whatever, I don't know. The body is never displayed at funerals. Open casket ceremonies are forbidden by Jewish law. Very different. Mourning. Basically, they're mourning periods. I told you about the 7 days. The mourner's sole responsibility is caring for the deceased and preparing the burial. Next period is of Shiva, that's the 7 days. Then the next period is 30 days after burial. And then there's another period that goes on for a year. I like this. When visiting a mourner, a guest should not try to express grief with standard shallow platitudes. The guest should, if I can see it, should allow the mourner to initiate conversation. One should not divert the conversation from talking about the deceased. To do so would increase the mourner's ability to express grief, which is the purpose of the mourning period. On the contrary, the caller should encourage conversation. Let's see. So again, what did I tell you about good health for grieving? Don't say platitudes. Oh, let's talk about the weather. Let's get them a sidetrack. Talk about it. And then it goes on. for saying Kaddish for up to 11 months after. Prayers recited for up to 11 months after. And then burial, very specific, what you have on tombstones, when they're put there, the whole, very, very specific. Muslims, death is seen as return to the Creator. Burial is the custom. Cremation is forbidden. Leave the bodies return to the earth where it originated. So you prepare it, you wash it, the family does this. Women wash women's bodies, men wash men's. With the exception of spouses, which may wash one another's bodies. Bodies wrapped in a clean white cloth. Their ritual takes place within 24 hours, or as soon as possible. Only men participate in the burial.
Whoa.
Young children are typically not present. Very interesting. I think we have some ideas about that. So, Imam or holy man officiates. Mourning period lasts for 3 days for most and 40 days for a surviving spouse. Now, you can mourn for other people. Muhammad's grandson. So they have 68 days of mourning for Muhammad's grandson. So it's not just the people. Eastern Orthodoxy. On the third day, and always in the daytime. Sometimes men in mourning will not shave for 40 days. Why? What is this 40 days? The 40 day has great significance in Eastern Orthodox religion. That's a period during which the soul of the deceased wanders on earth. On the 40th day, ascension of the soul occurs. Prayer should be held on a grave site of the deceased. So you don't just go right up 40 days. Buddhism. Many different types of Buddhism, meditation. They want you to be able to meditate, to participate in your death, to be there at that moment. So trying to drug you out or things like this, if you ask them, those Buddhists would not necessarily want that. Cremation is typical. And I'm going to say much more about that later. Christianity, we're all familiar with because we're in a Christian culture. Dark clothing, Protestant, wide variety, we know about that. Roman Catholic, the last rites or right of the sick. I don't want to spend time on that. Blessed are those who mourn, for they will be comforted. However, the darker the night, the brighter the stars, the deeper the grief, the closer to God. Dostoevsky. Now, sometimes do these sayings, are these helpful? Sometimes yes, sometimes no. Remember from part 2, others want us to keep the faith. So when somebody dies, we want you to keep your faith. You don't want to go there, and you got to keep your faith. Are our faithful beliefs always helpful? No. Religion can also stir up and burden the griever with guilt and anger. Example, I'm going to read you an example of Heather. When Heather's teenage daughter died at 16, Heather was furious at God for allowing her to die so young, with life so unlived. Heather's family were deeply involved in the church and had been a strong support during her daughter's illness. But they had difficulty dealing with Heather's anger. She no longer wanted to hear about the God who answers prayers, since her prayers had not been answered. She felt judged by her friends at church for having so much anger at God. A friend said to her cautiously, "Be careful, don't invoke the wrath of God." At that, Heather was even more enraged. "What's he going to do?" she retorted. "Take my daughter away? What's he going to do? Take me? That would be fine. I'd rather be with her than be here." Her friend knelt down and said tenderly, "Let's pray for forgiveness." At that moment, Heather decided to leave her church behind and a number of friends. It was years before she ever even walked into a church again. Well-meaning, but so religion can cut both ways. It can be helpful and it can be extremely harmful. So what's the role God plays in the laws? Most common emotion is to be anger at God. That's common. That's normal. It'd be abnormal not to be really angry with God if you believe in God. But people want to suppress that. Some feel that was a punishment from God, that hospice patients, either for their loved one or else for some sin that they did. God's punishing me with this cancer for something I did. That my daughter died because she was sinful, something she did, or my son with AIDS. Sometimes grievers are made to feel guilty because their faith wasn't strong enough, or else they didn't pray enough. The minister, I've seen this many times, the minister, well, if you just prayed more, if you had more faith, then your loved one would have lived. In my experience, major loss either strengthens one's faith, whatever it is, or else dismantles it. But the belief system does not remain neutral. So that's one way or the other. Faith can make you stronger, or you can make you change some of the beliefs that you had before. The key concept in mourning is that I think it's overlooked is the loss of one's belief system. Star. That is part of the healing that is seldom addressed. So yes, you lose your loved one or whatever, but you may lose your grief system. Didn't we all grow up with this belief system? I did. People grow up in a nice family. If it's not such a nice family, you get through it, go out, get married, get a job, get kids, you're happy, live to your old age, retire, happy, die peacefully in your old age. Painlessly. Yeah. Well, what happens someplace along the line when some of those things go awry? And as a kid, well, wait a minute. My father died. That's not supposed to happen. Often one's belief system is crushed along with the loss. He was really health conscious and did all the right things. Yet he got a heart attack and died. She had all her medical tests and exams. Then she got breast cancer. I was a good Christian, prayed to God regularly, and have lived an honorable life. Yet God has taken my son. The child should not die before his parents. But she did. A child is not supposed to get sick and die. It's unnatural. But many do. You see how these belief, and we don't even address those. But those are under the surface. And I'm trying to coax them out here. What allowed the earthquake to occur? They don't expect an answer from that. There is no answer. It's just an open question. How do you cope if you have no belief system at all in which to frame or structure the laws? Which I think is much more common today among younger generations. They don't have any faith system. They don't have anything to frame these losses. So what do they hang it on? Sometimes we grieve, well, these life beliefs must be mourned separately. But they must be mourned too. Sometimes we grieve them first, and sometimes later on. They need to heal and regroup as much as your soul does. And I say this is part of grieving. Often one has to rebuild a new belief system from the foundation up. If not, you may have unresolved grief. So how do you have this big loss and then go on if you just leave your belief system the same, but it doesn't jive with what was supposed to happen? So you have your first miscarriage, then you have your second miscarriage, then you have your third miscarriage. Don't you start asking a question, why me? To whatever? What belief system? How do you cope with that? The paradigm of pain and suffering. Viktor Frankl, in his famous book, Man's Search for Meaning, pointed out that we can endure, survive, and even grow from the experience of pain if that pain and suffering have meaning. Big star, great book. This includes concentration camps, surviving on a raft, to suffering on a cross, or childbirth. pain has to be looked in the context of meaning. You can have pain and suffering and pain without suffering. The example I like to use on this is a woman to childbirth. So I have a woman and she's going through all the pain of labor. It's often horribly painful, going through it. But what do we have at the end of that? A life. Does the woman get pregnant again? Do we have more kids? Yeah. I mean, it's just kind of forgotten about. There are chemicals that help too, but anyways, you see that? Now, when I have a woman who has a baby die in utero, the baby's dead. Oh, we're going to induce the baby to get it out. Now what do those labor pains feel like? Same labor pains. Exactly the same. We're pitying her. How is one suffering? Are they both pain? Yes, but one is significant suffering because of the loss of meaning in that. Frankel was in a concentration camp, and he could tell the people that were going to survive. He said, I could tell the ones that might make it. I mean, obviously you couldn't because they were picked, but of the ones that did survive, it's what they had up here, the meaning of, even in that horrible situation, that allowed them to survive. So part 4, healing. Is there a model for healing? Specifically, what needs to be accomplished to heal as quickly as possible? When is grief pathologic? How can we recognize it? What impairs the process of healing and what helps it? How will we know when we are well or are we ever? What model for treatment do I use? It's an obvious fact that most people get through grief no matter what they do or don't do. Time does heal all wounds, or does it? So let me use the medical, not be too gross, but medical analogy. If I see someone and I'm doing their exam and I see the shirt off and I see this big scar across them, what do I usually ask? How'd you get that? They got this scar. Can you tell by looking at someone's scar what caused it? Not usually. If they have a little scar down here, yeah, maybe an appendectomy, very good guess. But if it's a scar that isn't supposed to be there, then what are a whole bunch of different possibilities? Injury, surgery, accident, self-inflicted bayonet. I mean, you can go on and on, right? It's the same wound externally, but very different cause. Now, I tend to tell people sometime when you have emotion, we understand physical. So, someone, let's say they get a cut, they're on a farm injury, they got a big injury here. And it's a big one. Okay, in the old days, you can just not come in and, well, I'm not going to the doctor for that. Some of these tough farmers, you know, yeah, but it's 3 inches wide. That'll get over it. You know, and then they often come in and they're in big doo-doo because it's infected. And then they come in. Or maybe it goes on by itself and it heals over, but there's still stuff in there. There's still a twig in the tree that they jammed in there. So later, what happens? Much later, I took some stitches out of a patient yesterday morning. And his gallbladder scar that was forming a sore. And I said, when did you have that gallbladder surgery? 29 years ago. And he's got this little sore here. And I said, we have something going on. Take it out. There's 2 permanent stitches that we ended up taking out. Well, that's a good example. Didn't make it up. It happened yesterday. So wounds can have things in them now that need to come out later, all after all this time. Okay. So the point I'm going to make here is that an emotional wound that you have always will leave a scar. Always. So think of an emotional scar. So people, you're going to have a scar from this loss, no matter what. It's there forever. But how long does it take that scar to close? And so if people come in at a certain time later and the scar's still open, 4 weeks later and it's still open, that's not normal, right? They come in 3 months later and it's still open. That's not normal, right? They need professional help for that scar. Or something, it heals over, but there's something in it. It keeps pus coming out, it keeps festering. That's the way some losses are in some grief. Some heal over naturally and are fine. Some don't heal over so well and do so well. So try to think of that in relation to loss and healing. I'll come back to that later. Although the great majority do seem to recover from their loss, whatever it is, about 5 to 30% get stuck or become pathologic grievers in need of professional help. And that kind of depends on your cultures too. You know, when you're going to go to the doctor or when it's considered and how much the social stigma keeps you down. So this is a graph of the traumatic event, post-traumatic event, whatever it is. That's all the death of a loved one. Here's the severity of symptoms: moderate, severe, mild. What do we tell you about grieving? Not what people think, 48 hours to 2 weeks. We're talking years here, folks. So this graph just goes out 2 years, but it's not down to baseline yet at 2 years. But notice how kind of this follows, we've seen kind of this curve, right? Up and down. And well, maybe an anniversary bounce, maybe not. But you see that? But look at this one. What do you think about that? Is their wound healing? That's the wound that's not healing. And that person is not. Will they seek help? Maybe, maybe not. What are types of different grief? Some people, chronic. Some people have delayed. They're okay, they get through some of the stuff, but boy, then after a year, they start going downhill. So in 2 years, they're worse than they were at the start. We have people like that. Some people, rapid recovery. They do well, and boy, they just seem to get back on track right away. And some people, the same traumatic event doesn't knock them off their feet as much. It's mild, they get better, and they just go out here. They're resilient. They have a loss, but doesn't knock them way off here, and they come better. So these are all different types of healing types. What makes the difference? We grieve in character. We all have different physical pain tolerances, don't we? Yeah, we hook you up to some little pain contrivance, and you're all going to push different numbers onto the amount you're going to take for it. We all have different emotional tolerances, don't we? Yes, all different. Although parts are genetic, I think we're born with these different things, most are learned, and therefore can be unlearned. People die in character. You find this in hospice. That is, they often die the way they lived. Is that true? Yep. People, when they talk, we're dealing with them at the end of their life, they're dealing with the same way as they did their other stuff in their life. Doesn't change a lot. What might make one a high risk for bereavement? What about certain types of loss? Multiple loss, sudden unexpected loss, suicide, social different disenfranchisement losses. You know, the AIDS, the stigma, that was my lover, but not my wife. I remember when I was a high school teacher and a boy in my class, and real go-to junior, just the sharpest guy, and he wasn't in class. And I said, what happened to so-and-so? Oh, didn't you hear? He died. I said, well, what did he die from? And the paper just said he died. Healthy kids don't just die. So a couple days in class, why did he die? He was doing sex. He was using his cord around his neck for a saxophone and trying to asphyxiate himself, because when you masturbate and you are partially asphyxiated, it sometimes makes that sexual feeling hot. But if you do one crank too many, it collapses your windpipe And we find not a lot of this, but it's not uncommon. This was 50 years ago. I had to skip class for 40. But it still happens today. How do you put that in the newspaper? When your friends say, well, what happened to your son? Oh, well, he was... I mean, you see, that's what I talk about. How do you grieve that? That's complicated. Multiple losses. You lose your mother. What about Teddy Roosevelt? His mother and his wife on the same day. Loss of a child. What's the number one thing that will make a marriage break up? Usually, loss of a child. Very high divorce rate the next couple of years after that. Losses on the multiple level. I talked to Wendy Abramson yesterday about grief a couple days ago. She talked about a little town in Pennsylvania she was from. We talked about loss. And she talked about the sadness in the community when the local mills and stuff went belly up and the town deteriorated. So people lost their jobs. They lost their stores downtown. They lost their retirement. They lost their community. All the loss on these multiple levels and how difficult that was. And you can't say, well, everything's going to be fine, just give it time, those will be back. No, they're not coming back. But you see all the different levels that can happen? So, first point is the type of loss. The second one is what about personality traits? Previously unresolved losses. If you haven't done well with a loss in the past, and another loss comes and nothing's changed much, those can piggyback on top of one another. And we'll talk about more next time about how you resolve unresolved losses. A history of mental illness, higher risk. Poor coping skills for loss in the first place. No social or personal support networks. You don't have a faith community, a church, a family, other people to support you in this. History of substance abuse. Medical bills, push family to bankruptcy. Think about this. How would you feel if you had a little girl and you mortgaged your house and everything, penny you had, you put for chemotherapy for this little girl who's got leukemia and then she dies. So then you get to $200,000, $300,000 bills from the hospital and the doctors, and you have to do bankruptcy. You've lost your daughter, now you've lost your savings, you've lost your house, you probably lost your job because you were with your daughter all the time, you didn't take 1 or 2 day bereavement. So think of all those compound losses that you have. Wow. And in our country, that's, I think, an insult that we have to be put in that position. That's just an editorial. Mary Todd Lincoln, in her mourning dress, following the death of her son Willie. She had had a death earlier from her children in life. Major turning point for Mary's emotional and mental states came with the next loss in her life, the death of 11-year-old Willie in February 1962. And he was really a precocious boy, talked how great he was. Both the Lincolns felt this loss grievously. But for Mary, who always was an extremely emotional woman, her sorrow of Willie's death was incapacitating. She stayed confined to her room for weeks, prompting Robert Lincoln to request Mary's older sister Elizabeth Edwards to come stay at the White House. When she left 2 months later, the president arranged for a nurse. Mary could not look at anything connected with Willie. Nothing she could look at connected with him. She removed all of his clothes and possessions and never again invited his good friends, Willie and Tad, her playmates, to the White House. There's a point in time where she's going through this and the president and he are walking by the window. And he walks to the window and points to a building over there. And says, Mary, that's the asylum. And if you don't get better, you're going to be there. And she did go there. So, already, if you've got mental incapacity, something like this can literally tip you over the edge. A model for grief therapy. I use a pyramid model for treating sexual dysfunction, which adapts nicely for grief therapy too. So, that's the pyramid. I find in sex therapy and in grief therapy, basic information and validation are the foundation. Most people need to know some facts. They don't know some of the central facts. They don't know what's normal. They just know what society has told them, or what they think, or what their parents told them. And when you just give them some basic information, hey, everybody does that. Wow, they do? Oh, because they can't talk that to mama or daddy or anybody else, right? Or your behavior, or your sexual attractions, or whatever. In Grief and Grieving, the next class, I'm going to give you a couple dozen of these basic information things. We've already told those, like, get your emotions out, get in tune with your emotions, find other people. So, very specific things. So, a lot of people, the majority of people, you just give them some basic stuff, and they're cool. They just got this thing that they read, or, people are supposed to have sex this often, and they're not, and so they think, what's wrong with me? And I go, no, people don't really do that. And then they go, oh, well, I ain't got a problem then, do I? And I went, nope. Seriously. It's that easy. The next one, specific suggestions. Some people need a little more therapy. Okay, we got the information stuff. Now, these are some suggestions, the things you need to do. And these are the things that you have to do. If you don't do them, you're not going to probably get better. You can choose to do them or not. And we're going to go over those next time. What suggestions I have on grief and grieving for you or other people. And exercises. We have specific, in sex therapy, sex exercises. People are supposed to go home and practice and do this, and do it so many times this week and bring it back. Homework assignments, like the ones we did on which we'll get to, and I'm going to incorporate on the loss chart that you did. And if you didn't talk to your significant other person about that, you still have another week to do that. And I'll be remiss that I didn't, but Lynn and I are going to do it this week. So we'll have that by next time. But that's important. So you do those things. And then, sometimes intensive psychotherapy. Some people need more. They got to go deeper. This is a really bad problem. Let's say they were sexually abused by their father. You ain't going to just get that with basic information, specific suggestions, and a few exercises. You're going to have to get down deep into that. And likewise with grief, some people that are stuck in grief that I've seen in my practice that can't get out, that have done all this stuff, that just are not resolving their grief, I'm going to tell you next time the technique that I've found to be useful on what to do. And I'm going to practice it and use it in my case too about the death of my father. It's called unresolved grief and how we can resolve it even though the event happened a long time ago or it's not resolved. And it involves writing about it, talking about it, and doing a couple things about it. So I'm going to give you specific suggestions on that. Why the imperative to treat? Who cares? I mean, it's not such a big deal. Approximately 25 to 30% of substance abusers have unresolved grief issues. Duh. Did you ever think of it? No, most people don't. They go in, let's treat the alcoholism, treat the alcoholism. 50% of those people, by the way, in good programs find they've got other comorbidities. They've got depression, chronic anxiety, OCD, ADHD, all this other stuff. 50%. But I posit that a large of them have unresolved grief issues. And if you're going to do that, they're drinking to self-medicate. So if you haven't got this grief thing, why do you think they're going to stay off their substance of choice? They're not going to, in my view. A much higher percentage, over 50 of those incarcerated have major loss issues. So those of you that go to the prison, if you do interview some of these guys, ask them to do a loss line history, I bet you it's going to be pretty impressive. Do you think that might have something to do with why they're there and what crimes they committed? People who abuse children were what? Usually abuse themselves. And I guess that didn't get dealt with, did it? And so their children would abuse their children, is going to keep going, or you're going to break the cycle sometime. Suicides, I would posit, have almost 100% inability to have dealt with losses. Duh, why are they killing themselves? What have they lost? They've lost the will to live. So if you get to a suicidal person and find out what are they grieving, what are they losing, before they kill themselves, you have a little chance to maybe do something with that. For children who are abused, there are great issues of loss. And I saw a statistic in Iowa, how many kids, it was pretty scary, can't remember exactly, it was 20 or 30%, which blew me away. This is Iowa, this is not inner city, Detroit, or the South, or wherever. Sexually, emotionally, or physically abused. Or combination of above. That is a lot. So, we don't want to talk about it or know that it's out there, but it is. I would also propose that nearly all PS, post-traumatic stress disorders, and veterans' depressions are also related to loss and or survivor's guilt, or combination. We don't go back, we don't program, we don't talk about that, so we just go on. Man, I'm telling you, it'd be there. It's not going away. Are the above treated with a specific focus on how they grieve or failing to grieve? I think not. Very few professionals are trained either to recognize the significance of unresolved grief or else trained to do anything about it. I surveyed all of the doctors. I got a back from about, I'd say 80%. And sent them the question, how much grief training did you have in your medical training? And of course it varied from Zippo. Some, I had a few hours, I had 4 hours. And so, yeah, there's some training. But I would ask you as patients, how often does your physician ask you for some physical loss that you're having, how are you feeling with that? How are you dealing with this loss emotionally? How are you doing with your loss of hearing? How do you feel about that loss of a breast? What emotions are you having with that? You're going to have a colostomy. How are you feeling about that? Feeling about that? Gee, you've lost your spouse. How are you feeling about that? How are you doing with your grieving? Raise your hands if you've had your doctors ask you those questions. A couple. Good. Not a lot. So even, I'm just saying, we're supposed to be the healing profession. But this is an area that is vastly under-trained and served. Besides, just helping to relieve some of the pain and suffering of loss itself is a pretty worthwhile goal, I would posit. Okay, so next time, I want to try to give you a model for self-treatment and other treatment. Just kind of bang, bang, bang. Down and dirty, these are the things that I think are helpful for wherever you are on that pyramid. So I'm going to give you some suggestions and more specific things, and then we'll move up. And even if you're hardcore, what can you do? We'll talk about support groups, things like that, and then try to integrate all this into some of the homework that you did, and talk about the movies, and I guess we could talk about the Packers if we have to. But, I guess I'll do that for a later discussion.
I mean, that loss is so, that is ridiculous.
Okay. Tommy's comment was that loss is ridiculous. Now, let me just lead into my last class. One of the statements that you will see me put up here will be, loss is individual, and loss or value is dependent on the value that that person puts in the loss or value. So some people said, oh, it was just a dog, it was just a cat. Other people, oh, it was just a dog, it was a cat. No. And what is the proportionality to that? How much you love, how much you grieve. So it's a teeter-totter. So if you really love the Packers, you're going to grieve more than if you don't give a rat's about the Packers. But to tell them they ain't grieving is not right. They are grieving. And you put your value system, if you lose all your knitting and I go, I don't care, you leave your lint bag here. Yeah, but I worked 5 days on that. It's just a lint, you know, who cares about that? So anyway, you see where I'm going next time. So anyways, this is fun, and I hope you come back at least one more week. Thanks. Thanks, Tommy.
I'm willing to bet that those of you who raised your hand that your doctor had talked to you about those things are patients of JR, right? Look forward to seeing you all again next week, same time, same place.